very excited to introduce our next guest. I think she cruised into town 4 or 5 years ago and she's a person that wakes up every day thinking about maternal mental health. She's brought that information to our community. She's elevated the issues of maternal mental health. I have the privilege of serving on the Maternal Mental Health Advisory Board, which she founded and leads. Her name is Dr. Heather Flynn. She's the Associate Professor and Vice Chair of the Department of Behavioral Sciences and Social Medicine at Florida State University College of Medicine. She's also the co-director of the Center for Behavioral Health Integration at FSU. Please welcome Dr. Heather Flynn.
Okay, good morning. I can still say that. It's 5 minutes till noon, right? How's everybody doing? Hanging in there? It's sad but true what Courtney said. I do wake up every day thinking about depression and mental health. This is my area of work since about 1990, and I guess good and bad news of that is we are now, almost 30 years later, and we haven't really made a dent in the prevalence or burden associated with depression and other mental health disorders. But the good news is there's exponentially more attention on this than when I first started this work, and people are talking about it. I think every speaker has mentioned it so far today, so that's really good news. So I wanted to share just a little bit with you about what we are working on with the board and with the FSU College of Medicine, in case we can be of any help or service to anybody in this room who are, all of you are doing amazing work around early childhood health, and we've been really privileged to link up with a lot of you. So mental health is a major influence on overall health and well-being of individuals and communities. I think everybody knows that in theory, but when you kind of look at all the different points of service and points of care, especially in the healthcare field, but also in social service segments, we don't routinely detect and address and engage people in mental health services. And unfortunately, Tallahassee is no different from most communities in the United States in that it's hard for us to know where to refer somebody for mental health services. There are good providers out there, but not everybody knows everybody, which is the point of this whole event. And then there's another issue around training and evidence-based services among mental health professionals and the difficulty accessing psychiatry services. So this is something we're all going to be working on together. So what do you think about when you think about mental health? Sometimes we think about media portrayals of mental health and the most severe end of the mental health spectrum, serious persistent mental health disorders, schizophrenia, bipolar disorder. Don't get me started on the stigma in this movie. It dispelled some stigma, but it perpetuated others. Unfortunately, some of us think of Andrea Yates, who drowned her 5 children in 2001. We're coming up on an anniversary of that in June. She still remains incarcerated. This was a woman who was repeatedly involved in the mental health care system, was well known to mental health providers, and continued to slip through the cracks. And a lot of that had to do with the fact that there was just not an awareness of how severe and debilitating this illness can be. But there's also the issue of not really knowing, who might have a mental health disorder. So our friends and neighbors, with a 1 in 5 prevalence, it's likely that we all encounter somebody every single day who has undetected depression, anxiety, things that are not reliably detected and treated, and things that are just as debilitating, as I'll say in a moment. So the take-home message here is you can't tell by looking at somebody necessarily if they're struggling with a mental health or substance abuse issue. And so all of us who encounter people in our roles every day, we would love to see this be part of kind of routine detection and screening. I'll get back to that in a minute. Pregnant women have a very relatively high prevalence of depression and anxiety. And again, doctors who are providing prenatal care, folks who work at the Department of Health, women, infants, children, encounter pregnant women every single day. And again, unfortunately, we don't have routine detection, engagement, and provision of services for people with mental health disorders, especially women during pregnancy. So Morgan mentioned that pregnancy is a great time to get started with needed healthcare services. Well, when a woman's pregnant, she's going to see the doctor usually quite regularly, especially near the end of the pregnancy. So this becomes a really key opportunity to detect and get people engaged in services. And I'm going to come back to that in just a minute. You may know that mental health disorders are the second leading cause of disability and burden worldwide, and that means more disabling and burdensome than lots of other conditions that we routinely treat, like diabetes, blindness, HIV, cancer. So it's second only to cardiovascular illness in terms of disability, and by disability I mean really not being able to function, not being able to work, take care of children, go to school, sometimes not getting out of bed, and it's highly disabling if you also have a medical condition with it, like heart disease, diabetes, that kind of thing. And depression and anxiety, the ones that we don't detect as routinely, are the most common mental health disorders. So 1 in 5 to 1 in 6 Floridians suffer from some form of mental health issue, whether that be depression, anxiety, or other mental health issue in their lifetime. And these issues, as you all well know, often present in childhood, adolescence, definitely during the childbearing years in women, which is again is a prime time because the longer somebody lives with a mental health disorder improperly treated, the more of a hold it takes. And actually brain studies show that the brain changes over time in a way that makes it more difficult to treat as somebody ages without wellness, without long periods of wellness. So early on in life, adolescence, pregnancy, this is a great time to detect and get people connected with services. Unfortunately, in specialty settings like psychiatry, we don't see people until they've had 3, 4, 5 episodes of the illness, and it's much more difficult. It's not impossible, but it's much more difficult to treat. So my new mantra, well, it's not new, but I want everybody to learn it. Mental health is health. There is no health without mental health. They're one and the same. And I'm going to talk a minute about how healthcare services should be integrated in our community. This is pretty common in pregnancy. It's considered the most common complication of pregnancy. So doctors and their residencies who are learning to become obstetricians, gynecologists, spend 4 or 5 years learning about every other disease of pregnancy. Gestational diabetes, hypertension of pregnancy. They spend lots of time learning about very rare prevalence diseases, which is very important for doctors to know about, but they get almost no training in detection of this most common mental health disorder in pregnancy. So you can see that about 10 to 15% of women during pregnancy and in the postpartum period may suffer from depression or anxiety. And this is something that affects the mother, as we talked about, over the lifespan, but also is already affecting the developing baby. So whatever's going on with the mother, I think everybody knows this, through the placenta is affecting the baby's brain, cellular, organ development, including stress, and all forms of stress, traumatic stress, stress related to discrimination, poverty, exposure to violence, depression, anxiety, all these forms of stress are shown to be having an effect on the development of the brain and leading to later early childhood developmental behavioral issues, but also medical issues later in life. So this is a prime time to detect mental health issues, behavioral health issues, effects of stress in pregnancy. There are a whole host of negative effects that have been associated with just depression alone, but also when it's co-occurring with anxiety or with a medical condition like kidney disease or gestational diabetes or hypertension, it significantly compounds the effect on the baby. And I'm not going to go through all these, but you can see that there have been luckily, there have been a lot of studies on this. It's extremely costly for communities. So this is why I'm so happy the city and cities across Florida are beginning to pay attention to mental health, because it's incredibly costly for communities, especially when it occurs around childbearing and in mothers. But more importantly, I think, are the human costs of depression, maternal mental health, anxiety, and all the things you see here have been linked to underaddressed or unaddressed mental health issues, both in the mother and in the child. So all of you who work in early childhood settings, the things you're seeing may or may not have been related to what has been going on with the mother in her life before she conceived and during the pregnancy. And this is, again, why we really stress detection, ideally preconceptually, but at the point of pregnancy, this is a great time to do some detection and addressing of these issues. So at the FSU College of Medicine, we have a program known as ACT Now, Advancing Care and Treatment to Enhance Outcomes for Women. And we have some research that goes on as part of that, but as Courtney mentioned, we have a whole host of community partnerships that are equally, if not more important than the research, in terms of working together to find solutions to fill some of those gaps in the detection and treatment of maternal mental health issues. Here are some of the agencies and organizations that we're partnering with. And as Morgan mentioned, for the past 2 years or so, we've been adding a maternal mental health screen at the Developmental Screening Day in April and October, and we're compiling the information, and we have summaries, and we are seeing elevated rates of depression among the women bringing any caregiver actually bringing their child in. But this is just one example where we kind of want to intersect with everything else going on in the community. Any point of care for a woman during pregnancy or after having a baby would be a great time to try to engage her in services. It doesn't necessarily have to be treatment, but whatever services, social support groups, any help that would alleviate some of the pressures and stress on the parent. We're partnered with the Autism Institute and First Words. Anybody here from First Words? Card. Okay, so we're beginning a program there to do some screening of the caregivers who are going through the process of assessment, diagnosis, and intervention. We also have a project in child welfare where we're taking a look at how child welfare is addressing parental behavioral health issues. So these are just 2 examples of points of contact with families. Most of my work is with obstetricians, who really are the front line, for detecting these issues. If they're going to be detecting medical issues, they need to be detecting mental health issues, because again, there should be no separation. So one of the things we did from having events like this and having people work at their tables and identify gaps and potential solutions to addressing maternal mental health in Leon County, one of the suggestions that came up is that we should have a dedicated coalition just focused on maternal mental health. And so we formed the Maternal Mental Health Advisory Board. Heather Van Sloskus is here, and can you raise your hand? She is our coordinator of all these activities. Kelly Mercer is here. She's on our board. Courtney's on the board. Am I missing anybody else? So this has 21 members, and our mission is to facilitate community collaboration and to serve as a forum for exchanging ideas, kind of like today, just so everybody knows what everybody else is doing around this topic and where are opportunities to grow some of these areas, to help identify and treat women with depression, anxiety, any behavioral health issue, to linking them with quality services through an array of activities. This is the full list of people currently on our board. You may know some of these people, but what we're trying to do is get representation from different roles and agencies and organizations. And through hosting events like this, where we had the community tell us what are some of the areas of need and potential solutions, here are some of the themes that we learned from you all in Leon County. We need more in terms of education, training, professional development, clinical services, and research. And so in response to this, we've been trying to get as many partners as we can, and everybody here is welcome to join us to address some of these issues around improving awareness, education, training of professionals, and quality of services, and all the while studying what we're doing so that we can convince other people that it's working and that it's important. One of the things that came out of our work, and I would love to pass this along, is we developed a mental health resource guide for Leon and Gadsden County, and you can find it at this link. It's also on Big Bend 211's page, as well as Whole Child Leon, the United Way, and Tallahassee Primary Care Associates are going to help us make it even better. But currently, this is a list. We basically went through all the providers that we could find on any other list, and essentially driving around town, and got them all onto a searchable database. You can search by insurance type. You can search by the kind of clients they see or services they provide. And we are trying to keep it as updated as possible, so we have current information on their phone numbers, hours, and insurance they take, and that kind of thing. But this will get bigger and better, and if anybody, there's a portal you can go in and make suggestions. Here are some of the things, experts and interests we have in the FSU Department of Behavioral Sciences and Social Medicine, but we're all about behavioral health. So all of our faculty study behavioral health and do work related to behavioral health. So please contact us if you need any resources, help, information. One of the things that I alluded to in the beginning that we're really moving towards, and luckily the whole U.S. is beginning to move towards this, is this concept of integrated behavioral health care. The main way we think about integrated care is in medical settings, primary care, emergency departments, peds, OB, where the world is trying to move towards, let's not separate mental health and medical care anymore. There's no reason. It's completely historical and stigma-based, the reason they were separated in the first place. So now there are models out there. There's about 20 years worth of research showing that when you have behavioral health professionals and medical professionals working in a setting together, you can drastically improve mental health outcomes. And that doesn't just mean co-locating people, like having a mental health professional in the doctor's office, but having them literally plan the care together, coordinate, communicate, follow up, monitor. If someone started on an antidepressant, see if it's working, if they're getting better, if they need to switch it up. Adding behavioral health counseling-based services, which are just as effective as the medications. And so this is something that our FSU Center for Behavioral Health Integration, we're just trying to disseminate accurate information on how best to do this in not only medical care settings, but also in social service segments. As I was saying, the Autism Institute, child welfare, we really want to do integration all the way around in our community so nobody gets missed. So this is our center, and this is the mission of the Behavioral Health Integration Center. We have a Dropbox with models and information on how to do this. We're continuing to develop it. But one of the things that we do is provide guidance on anybody who wants to integrate care. And that involves, of course, screening for behavioral health disorders in whatever setting using validated tools, because as I said, you can't tell by looking at somebody if they have a mental health disorder necessarily. But then what we know is there's a huge gap between screening and receiving treatment. There's a lot of issues and steps there. So one of the things that we're really working on is that engagement piece, and that's the theme of today. But there are ways, best practice ways, that you can communicate with a person around making a referral that significantly increase the likelihood that they'll follow through with that referral. And one of those approaches is known as motivational interviewing. How many of you here have heard of motivational interviewing? Oh, wow, that's great. So what we know is that in communities, people usually want additional training in these kinds of client-centered communication approaches that increase the likelihood of follow-through, and that's something that we do at FSU. I was going to say University of Michigan. That's what we do at FSU College of Medicine, is we can offer trainings, and then for providers, for mental health providers, We can do trainings in evidence-based approaches themselves, like cognitive behavioral therapy, interpersonal psychotherapy, things that we know if a clinician does these things, it's much more likely to lead to improved mental health outcomes and learning coping skills to combat relapse. So that's all I had to say. Hopefully I stayed on time. Does anybody have any questions or bits of information to offer your colleagues?
I'm kind of curious about like what community organizations are offering this like integrated approach to the extent that like you do have physicians and mental health care staff working together. So do you have any off the top of your head, or is that like included in the portal that you gave us the link for?
Well, that's a great question. She's asking if I know of any organizations like primary care centers that are already doing a really good job of integrated care. Not coming to mind anything in Leon County, but that's exactly what we all want to work towards. There's an excellent example in Immokalee, Florida, at the Federally Qualified Health Center there. They have a women's health and a pediatric service, and every single patient that comes in sees a social worker or a psychologist right along with the primary care doctor. It's not like leaving it up to the primary care doctor to decide whether or not somebody should speak to them. It's just routine care. Everybody has a behavioral health need, we assume, whether it be adherence with medication or exercise or depression, anxiety. So they get 100% follow through with a behavioral health provider because it's just part of the team, and that's the way, according to the national standards, it's supposed to look. And that's so. If anybody here knows of any good examples of that in town, that would be great. But I don't right now. Any other questions? Yes.
Have you heard of the implicit model that was developed by the March of Dimes? Mm-hmm. Have you heard that there's anything, thoughts about doing that with either the primary care providers or the pediatricians in town?
That would be an example of a good model that we could try. I mean, and the engagement of the primary care practice is its own challenge. But from what I understand, there's a lot of interest in talking about how it could be integrated. Tallahassee Primary Care Associates, is anybody here from TPCA, has 2 master's level behavioral health clinicians full-time, and they're booked out 6 weeks right now. So it's starting to happen, and now is the time to bring in models like implicit. There are many models, though, and it has to be customized to each individual culture, neighborhood, whatever. So we can't plop in an evidence-based model into any setting. Great. Okay, I'm going to wrap up. Thank you guys so much for your work.